Just wait a minute. So in 94, so it is not useful, especially when we have a local disease. So either in acute local diseases of recent origin, or having a chronic disease. Either in acute local diseases of recent origin, very recently that person having a eruptions, or in local affections that have already existed from long time, or the person having a skin eruptions from a long time, and when used internally. So in these circumstances, to rub in or apply externally. So to rub in or apply externally to the spot an external remedy. When we are dealing with local diseases, and just wait a minute. So whenever we have a local disease or local affections, Dr. Hahnemann said rubbing in or apply externally any external remedy, or any place you cannot apply any external remedy there, it is not useful, even though it be the specific one, or when used internally, solitary, producing good effects beneficiary by reason of its homeopathicity, even though it should be at the same time administered internally. So person comes to you, and I have seen so many times doctors give some uh, mother tinctures to use externally, or other remedies to apply in externally. We have to avoid this. And Dr. Hahnemann says there is no useful of these external applications of the remedies. Maybe they are specific in their data. They may be specific in, especially in allopathy. They already giving lots of external ointments to use for psoriasis or eczemas or many other remedies. Sport on external remedy, or even though as to be a specific, maybe that remedy is specific, and when internally used, maybe they have a good effects because of that remedy is homeopathically suitable for that cases, even though it should be at the same time administered internally. Maybe that person taking that remedy internally, but it is no usefulness of using the same remedy externally. So first thing, we have to concentrate on this thing. We will, if somebody having a local affection, avoid as much as possible to use any external medicinal substance. So for the acute topical affections like inflammation of individual part, erysipelas, etc., which have not been caused by any external injury. We already discussed that there are two types of circumstances where skin involved. First is injury, external injury, and second is dynamically. If that skin eruptions, that skin lesions coming after external injury, then we already discussed what we have to do in these cases in aphorism number 186. In these circumstances, we have to read 186, and we should know that where we can use this external remedies or when we can use homeopathic remedy. So it should not be caused by external injury of proportionate violence, but it should be created from, it should be come from dynamic causes or internal causes. That eruptions, that skin lesions should be come from dynamic reason or internal reason, not from external injury. Yield more surely to internal remedy homeopathically. These all circumstances when the external lesion, external eruptions come from dynamic or internal causes, they yield, they solve, they annihilate completely with internal remedies homeopathically. Adaptive to perceptible state. Can anyone tell me what is perceptible state? Anyone? Adaptive to perceptible state of the health present in the exterior or interior. Perceptible, perceive. These are the two sides of coin. What we perceive, what we already taken through our case taking, what circumstances, what type of lesion the doctor or the patient show us, we perceive. We perceive it emotionally, we perceive it mentally, we perceive it physically. We go through head to foot everything and we check it out. Adapted to perceptible state of health present in the exterior and interior. That circumstances, that dynamically deranged disease, dynamically deranged person affected externally and internally. Whatever we are seeing on the skin, whatever we are looking on the skin, whatever the eruptions, whatever the problem that person having on skin is because of internal reason. Internal reason. And we describe it as a local disease. And Dr. Hahnemann says these eruptions very quickly yield to yield to homeopathic remedies. And what type of homeopathic remedy? What type of homeopathic remedy? The remedy which are proved medicines. Only proved medicine, not other thing. Only proved medicines. And generally without any other aid. We don't need any other aid to solve these problems. If we don't understand, this is a different story, different scenario. But according to Hahnemann, we can easily improve such type of cases internally and externally with the proved medicines. But for example, you take the case, you select the medicine, you prescribe the medicine. Even after prescribing your medicine, you are not able to yield this, not able to cure these circumstances. That what we can do. So, but if these diseases not yield to them completely, so this can be the circumstances. If you prescribe the remedy, you, even after your prescription, the patient is not able to cure. What we do? So if the disease do not yield to them completely, and if they are still remain in the affected spot, the eruptions is already same as there, and eruptions is not coming down, the eruptions is not inhalate, then, and in the whole state, the affection is there, the whole state is there, and you give the best remedy to them, notwithstanding with the good regimen, you give a good diet, everything was good, you avoid all the medicinal substances, you take care of everything, but still you are not able to solve this problem, then relic remain of disease which the vital force is not competent to restore to the normal state, then the acute disease was, and as not infrequently happen, a product of sora. This is because of soric constitution, soric tint, soric miasm, miasmatic region, as we already discussed in aphorism number 5. Exciting and maintaining causes. And the third one is fundamental causes. Because of that fundamental reasons, the patient is not able to yield. Now we need a miasmatic remedy. Miasmatic remedy, which had hitherto remained latent to the interior. Because of that reason, patient is not able to dissolve his eruptions, but has now burst forth and is on the point of developing a palpable chronic disease. Now this disease is converted into chronic disease, and many times you will see that the person having few small pimples, and when you ask, because they already use mustard oil most of the time in India, especially in the North India, they use mustard oil. And if you know the ingredient of mustard oil, sulfur is so much high level present in mustard oil. And if you use this on external eruptions, it will reduce the eruptions immediately, but it will develop into a more serious problem. And I have seen so many times psoriasis cases. In psoriasis, people use, who is using this one? People using mustard oil to solve the tightness of the skin. In these circumstances, these eruptions momentarily reduce, but after that they aggravated, they increase. So now we have a rough idea that if we have any external disease, don't apply externally, use internal remedy. And if you guys are not able to solve this problem, then we have to go for miasmatic reasons. This one, 194. In 195, in order to effect a radical cure, if you want a complete cure in such cases, which are by means, no means way, this is not rare, we can do it. After the acute state has pretty well subside, once the acute phase subside, and appropriate antisoric treatment, as though we already discussed in chronic disease, must then be directed against the symptom that still remain and morbid state of health to which the patient was previously subjected. Person having a acute problem, he recently have eruptions, he recently have a itching, he recently have a skin eruptions. So once this phase goes down, give a antisoric remedy, the remaining part, especially the remaining symptoms which remain after your local, the ordinary medicine you already give for specifically for that acute conditions. And in chronic local maladies that are not obviously venereal, should not be venereal diseases. These are antisoric treatment, internal treatment, or whatever alone requisite. We required only antisoric treatment in these circumstances, especially if we want to cure the local diseases. Then in 196, it might. So it may be a circumstances. It may be. This is just a probably, Dr. Hanneman. Imagine that we can. This can be happened. It might indeed seen as though the cure of such diseases would be hastened by employing the medicinal substances which is known to be truly homeopathic to the totality of symptoms, not only internally but also externally. Because the action of the medicine applied to the seat of the local affection might be a more rapid change in it. Here, Dr. Hanneman doing experiments because, and that time, most of the local diseases are ameliorated or eradicated by local applications of the remedies, local applications of the medicines. So Dr. Hanneman says it may be if we use the same remedy internally and externally, it will hasten, it will speed up the recovery. But in 97, Dr. Hanneman gave why we are not, why we don't want to do this type of stuff, why it is more dangerous, more dangerous. So in 97, Dr. Hanneman says this treatment, however, is quite inadmissible. This is not allowed or not tolerated. Not only for the local symptoms arising from the miasm of Sora. This is just because the symptoms coming from Sora, but also and especially for those originating in the miasm of syphilis or psychosis. So Sora produce scabies-like disease, skin itching, psychosis, and syphilis. Both create atypical eruptions. Typical eruptions. And For the simultaneous local application, if we use local application, then you can dissolve the eruptions, but you can trigger the internal disease, which will not stoppable then. So simultaneous local application along with the internal employment of the remedy in disease, whose chief symptom is a constant local affection. Chief symptom was constant local affections. If we use internal and external, has this great disadvantage. If you use internal plus external, internal remedy and local applications of the remedy, so much disadvantage that by such topical application, the chief symptoms, local affection, will usually be inhalated sooner. They inhalate, they dissolve, they eradicate very soon than the internal disease. Eruptions complete, the internal disease is still there, but after that, this internal disease again produce symptoms because the internal disease is already there. And we shall now be deceived by the semblance, the outward appearance of a perfect cure. Or at least it will be difficult, in some cases impossible, to determine from the premature disappearance of the local symptoms. If the local symptoms gone, it is very difficult or sometimes impossible to find out, determine the disappearance of the local symptom. That's why so many persons having a very advanced diseases, and they forget that in recent time they have any skin eruptions or some symptoms like this. And if the general disease is destroyed by the simultaneous treatment of the internal disease. That's why if the condition, if the local disease is dissolved, because most of the times we believe that if these local affections are eradicated, it means the person is already cured. But many times when because of some reason they use the local remedies, and these remedies for momentarily times give relief, but after that these eruptions, these internal disease, or these the person having so many other complaints started after a period of time. So here Dr. Hahnemann says, if the person having psoric eruptions, psychotic eruptions, or internal or syphilitic eruptions, we should avoid to give a external applications of any remedy. So we have to solve these cases internally with internal remedy. But in 198, so the only topical employment of the medicine that are powerful for cure when given internally. Local diseases, local medicines, use of that most of the times they use sulfur for external application. And even nowadays, if you see so many ointment having a sulfur for external ointment. But he says the only topical local employment of medicine that are powerful to cure when given internally, when these medicine given internally to the local symptom of chronic miasmatic disease, is the same reason quite inadmissible, not acceptable, for if the local affections of the chronic disease be only removed locally or one-sided manner. The internal treatment indispensable, absolutely necessary for the complete restorations of the health remain in dubious obscurity, a situation or idea that is both doubtful and questionable or unclear or difficult to understand. For example, you know that a typical type of product we can use externally, and that remedy has a powerful medicinal substance, he can cure it. He said, mere local employment of medicine that are powerful for cure when given internally. The local symptom of chronic miasmatic diseases is for the same reason quite inadmissible, not acceptable. For it, if the local affections of chronic disease be only removed locally and is one-sided manner, the internal treatment indispensable, absolutely necessary. In these cases, internal only and only internal treatment is needed to solve these problems, not local applications of this. Maybe that medicinal substances may be having a power to solve that eruptions locally, but we cannot use that substance for external use. For complete restorations of health remain dubious obscurity. Because reason, the chief symptoms, mostly in these circumstances, the chief symptoms is gone. We use that substances externally, chief symptoms gone. The chief symptoms gone, and there remain only the others less distinguishable. Because if somebody having a external eruptions, mostly it show that area, it show that particular part, it show that particular sensation, it show that particular discharge from it, typical eruptions, type of eruptions. We have lots of information there, but once it gone, so we have what we have nothing. We cannot describe these internal distinguishable symptoms. We cannot get these symptoms again. Symptoms which has less constant and less persistent. Less persistent. Less constant, less persistent than a local affections, and frequently not sufficiently peculiar. They are not peculiar then, and too slightly characteristic to display after that. Once the characteristic of symptom, for example, one person having a eruptions on elbow, between elbow, and the person feeling of constant tickling, constant pricking sensation, and he says, doctor, whenever I go out, because outside is hot weather, whenever I go out, it aggravates. Whenever the heat comes here, it aggravates so much, and I feel that some small pins are striking here. So much itching. And most of you guys can find out the remedy. Can anyone? Local eruptions, pricking, small, like a small pin striking on the particular part. Heat aggravate.
How about hypericum?
Hypersulf? No.
Hypericum.
Sulfur.
Sorry?
Because it's
Natramuse.
No.
Sulfur.
Apis.
Apis. This is apis. Picking, small picking. Whenever he go out, heat aggravate. Sensations. So now he used the local application and that eruption's gone. Did you get anything? Because all these circumstances gone, all these peculiar sensation gone, all these characteristic gone. So there is nothing now. Now the person having showing that, look at this, doctor, there is a discoloration here now. No eruptions, just a discoloration. I am coming here for discoloration. What we give for the discoloration, because he already destroyed the characteristic symptoms of the disease. And sooner or later, this will come again. So, one circumstances, there are so many examples we have. Metastasis, where one disease is fully eradicated, fully gone after the use of these local affections and start a new disease. Can anyone tell me the remedy for this circumstances? One is completely gone and a new disease started. This is called alternation. And materia medica, especially if we see abrotinum. One is completely gone. Other condition is absolutely new and restarted. Skin eruptions gone, heart disease started. Skin eruptions gone, abdominal complaint started. Skin eruptions gone, the person become emaciated. Skin eruptions gone, rheumatism started. Diarrhea stopped, rheumatism started. One remedy is calmia. When eruptions gone, especially a heart, it affects the heart. And most of the time, sorry?
In zincomet also suppressed eruptions. Zincomet.
Yes.
Suppressed exanthemata.
Yes. But in Zinca metallicum, you will see once the eruption's gone, it directly affect the brain.
Nervous system. Yeah.
But not heart. If heart involved directly, then calmia. And if respiratory system involved, and most of the time, so there are lots of example where eruptions gone and person having a chest affections. So many asthma or lungs diseases, so many types of. And
Sorinum also.
Yes, sorinum also. So many diseases. This is because of that local applications of diseases, local applications of medicines. But in 199, aphorism number 199, the remaining perfectly homeopathic, if the remedy perfectly homeopathic to the disease had not yet been discovered, we are not able to discover that remedy, not able to find out. At that time when the local symptoms were destroyed by a corrosive or desiccative external remedy or by the knife, then the case becomes much more difficult on account of the too indefinite characteristic and inconstant appearance of the remaining symptoms. A person reaches to you before the eruption's gone. He used so many types of ointment and remove all these symptoms. After that, he reach you. Definitely, there is no characteristic and inconstant, not constant, inconstant appearance of remaining symptoms. For what might have contributed most to determine the selection of the most suitable remedy. So we are not able to find out the characteristic remedy and its internal employment until the disease should have completely annihilated, namely the external principal symptoms has been removed from the observations. Until we remove it from internally, we destroy, we suppress. This is called suppressions of the disease. This is suppressions. As was the case before my time, the remedies of condylomatous diseases. Before Hahnemann, most of the times people use local applications of the diseases. And next, aphorism number 200. Had it still been present to guide, if local affections are still there, they will help us to solve the case. If the person having a local symptom, if the person already having a skin disease, it will help us in internal treatment. The homeopathic remedy for the whole disease might have been discovered. Then we can discover, because we have location, we have sensation, we have modalities, we have concomitant symptoms. And you will not believe whatever Hahnemann said in Organon of Medicines. These characteristic, these peculiar, these very, very unique symptoms, all these are concomitant symptoms. Everything is concomitant. And if we focus on concomitant symptom, we will understand homeopathic very well. Doesn't matter how advanced the pathology is. Just focus on concomitants. Find out concomitant in every case. You will solve the case. I give you one wonderful example. And this is a mental disease. Person having a mental disease. This is a slightly different case, but I just want to give you a small example. 2 days before, I have a call, and the person having a very anxiety, so much anxiety inside, and the person says, I have some issues. I'm not able to sleep. I'm not able to focus on me. I have no appetite. I don't want to live. And he came here 2-3 months before, and he faced a financial loss. He faced a financial loss because of some reason. His car was damaged, and that car was not repairable. And after that, he has to purchase a new car, and that new car was so much costly. In meantime, whatever work he get from outsider, they are not giving him work now. So the financial crisis is there, and he become mentally sick. In delirium, he says, "Oh, nobody was mine. Everyone is gone. Oh, how I survive? How can manage everything?" This type of things he was saying in his brain in delirium. Most of the time, whenever he sleep, he aggravate. All these circumstances come out. Everything. That's why whenever he try to sleep, immediately all these things come out and he wake up again. And he says, "Oh, I have something," and so much restless, so much restless. And one thing, doctor, I there are lots of heat from my body, and suddenly I become cold. Any suggestion? This was the case, and it cured in 24 hours. Any suggestion of remedy here?
Arnica, sir.
No. Why arnica?
Arsenicum?
No arsenicum.
For me personally, I have a lot of anticipation anxiety, so I take gelsominium.
Okay. If it is a case of gelsemium, the person become like this. Don't come near me. I'm okay. Okay, go. But he was, "Oh, something happened. Something happened to me." Like this.
Coffee.
Sorry?
Coffee.
No coffee.
So the
Aurum?
opposite would be pulsatilla.
No pulsatilla.
Oh gosh.
How about Aurum?
No,
Financial loss?
no.
Desire to live?
I want to show one thing. Focus on what is present, predominant, and persistent. Focus on it. What are you looking in the patient? Just focus on that thing. Don't go anywhere. He gave me a symptom. "Oh, doctor, I have this or that because of that reason. Now I'm not able to sleep." If you go for the reason, you will miss the remedy. He give you a characteristic. Doctor, he was constantly speaking, and doctor, whenever I sleep, I suddenly come out, and because everything is in front of my eyes, and when wake up, my heartbeat was rise up. I'm not able to sleep. I'm not able to eat anything. Whenever I go to sleep, this episode again. I'm not able to sleep. Very important. He gave you a very, very keynote symptoms. Anyone now? Any guess? Open your cameras. Open your cameras, please, first.
The reason he wakes up, is it due to fright, or is it due to some sort of fear, or he's basically stressed about the finances?
So he has lots of issues financially, but he says, "Oh, doctor, I'm not able to manage everything. I'm not able to do anything. My heartbeat increase. I'm not able to sleep. I'm not able to, doctor, I don't want to eat anything. Something happened. Something will happen to me." Very, very important keynote. First keynote is sleep during aggravation. Whenever he sleep, he wake up immediately because everything is coming his front of eyes. Now everyone have a remedy. This is laxis. Heat. Second important symptom, doctor, lots of heat coming from my body and suddenly become cold. second
flesh.
most characteristic concomitants of this disease. If you miss it, you miss the remedy. And third thing, he is unhappy. Distress. What is distressing? Circumstances. How will I manage? How I will manage? Whenever he try to sleep, 5 minutes, 4 minutes, immediately this episode come out. Immediately. Lachesis 200. I experiment with potency. Lachesis 200. Momentarily relief, but come it again. And if you guys have a Boger synoptic key, just open it. Dr. Boger says, whenever the choose remedy excite little or no reaction, you give the medicine. After your medicine, the person having a very little reaction or no reaction, the selection is either faulty, your medicine is wrong, or what is just a likely one of the fundamental reason behind it, or your potency is faulty. So in these circumstances, when there is no effect, I change the potency. I give him 1M, and after 1M, no episode. And I will tell you one more important thing. In such type of cases, don't forget to give a booster dose. What is booster dose? Do you have anyone having idea? Booster dose? Booster dose is a 200 potency in morning, 1M potency in afternoon, and 10M potency in the night. This circumstances will never repeat again. This is called booster dose. Whenever you have to finish the case, just give him booster dose and tell the patients, now you don't need me. Understand what is in front of you, just focus on it. If you have a evident cause, especially in acute cases, and whatever, these are mental diseases. Mental diseases are not acute. They are not acute. They are not coming suddenly. They are not appearing suddenly. Because slowly, the small internal affections are suddenly affect the nervous system. This is not acute. This is a chronic condition. And I record that case, but I'm not able to show you guys here because of they are not allow me. And one case I will definitely have one case, that case from Sweden, a lady 80-year-old. Next time I will show you this case because I have to record. I have missed the last conversation with us, and she has very, very, very unique symptom. Very unique symptom. And she says, doctor, I feel that I have no legs and I have very light, like I am in the air. I very feel light, very light. And this will be a question for you guys, and you will describe the remedy to me. I will show you the whole case. So here, predominant. What is predominant focus? Focus on it. Just remind, write it down everywhere. Present, predominant, persisting. Anything which is going on, persisting, continuously affecting the patient. If you leave it, you miss the remedy. You will miss the remedy. So here, if we had a eruptions, these eruptions guide us because it gives us location, sensation, modalities, concomitants, causations. It will give us and guide us for the internal treatment. Homeopathic remedy for the whole disease might have been discovered and had been found. And the persistence, look at this, the persistence regularly affecting the person, regularly in disturbing the person, regularly disturbing the peace of the person, of the local affection during the internal employment would have shown that the cure was not yet been completed. If the eruptions is there, it means the person is still internally diseased. But were it cured when it slowly eradicate from the local seat? On its seat, this would be the convincing proof after your internal remedy. If when this eruption slowly gone, it means this is the proof that the disease was completely eradicated and the desired recovery from the entire disease was fully accomplished. An estimable, indispensable advantage to reach a perfect cure. Now we reach to the perfect cure. So in aphorism number 201. 201. So it is evident that man's vital force, when encumbered something or someone in such a way that free action and movement is difficult, when stuck somewhere with a chronic disease which is unable to overcome by their own power, adapt the plan of developing a local melody on some external part. This is the evidence. Person having lots of issues. What if you open repertory, there are lots of example, lots of causations. And if you read ailment from in mental mind, ailment from this, ailment from anger, ailment from affections, ailment from care, worries, ailment from rage, ailment from violence, ailment from mortification, ailment from indignation. So many causations are there. When these are called psychosomatic diseases, the causation produce a excitement, and that excitement involve the whole vital force, and to save internal organ, vital force produce skin eruptions. So here Dr. Hahnemann says it is evident that the man's vital force, when encumbered with the chronic disease which is unable to overcome by its own power, adapt a plan to develop a local melody in some external part solely for this object, that by making and keeping in a disease state this part which is not indispensable, because the skin having is the outer covering. This is not a vital organs like heart or brain, nervous system to the human life. It may thereby silence the internal disease. Whenever these eruptions come out, the internal disease slightly silence because it show the eruptions on the outer part, local part, particular area is involved, which otherwise threaten to destroy the vital organ. If these eruptions go internal organs like heart, like intestine, like stomach, like liver system, it will destroy the vital organ and to deprive the patient's life. Maybe the person die, and that is, it may thereby, so to speak, transfer the internal disease to the vicarious local affections, as it were, though it thither to or towards the place. The presence of local affections thus silence for a time the internal disease to without being able either to cure it or diminish it materially. Vital force not able to cure it in that affections. So is not able to cure it or not able to reduce it. The local affection, however, is never anything else than a part of a general disease. We have to remember this. This is a part of internal disease. This is a part of in general disease. But part of it increase all in one directions. The internal disease is disturbing of one directions because it involves the skin. By the organic vital force and transfer to the less dangerous part of the body, and in order to diminish the internal ailment, because internally all the organs are safe, but they are coming on outer place. But if you read chronic diseases, if we destroy these local affections, so many times lungs involved, so many times nervous system, epilepsy comes out, so many times heart involved, so many times person having a ulcerative colitis, ulcers in the intestine, stomach ulcers. But by this local symptom, the silence of the internal disease, so far from anything being gained by the vital force towards the diminish or curing the whole malady, the internal disease, on the contrary, continue in spite of it, gradually to decrease, and nature is restrained to enlarge and aggravate the local symptoms always more and more. But slowly, it increase, it slow down. Local affection slow down the internal problem, slow down, but not cure, not diminish. It increase day by day. And in order that it may still suffice as a substitute for the increased internal disease and may still keep it under. All ulcers on the leg get washed as soon as the internal sora is uncured. The canker enlarge as long as internal syphilis remain uncured, just as the general internal disease continue to increase as long as time goes on. Slowly it increase, but not diminish, not decrease. For example, in footnote, the issues of the old school do something similar as artificial ulcer on external parts. They silence some internal chronic diseases, but only for a short time without being able to cure them. But on the other hand, they weaken, destroy the general health much more than is done by most of the metastasis affected by the instinctive vital force. So this is all about today's session. We discuss it, and the remaining part will be on next session. Now, if you guys have any questions, you can ask. We are dealing with treatment. These are the guidance, how we can treat, how we can treat homeopathically the local affections, especially local affections.
I have a question about the booster dose.
Yeah,
Like, what kind of cases require the booster dose?
I use every case.
Every case. Okay.
Yeah,
Thank
Few
you.
days back, you have put a case of sore throat. What was the remedy of that?
which one?
Few days back, you put a case of throat, acute case, last week, I think. But you have not mentioned the remedy. You put one case in on WhatsApp group.
WhatsApp group?
Yeah, yeah. I think sore throat case, acute case was there. Some everyone mentioned belladonna, arsenic. These kind of options were there. What was the remedy of that case? You have not finalized it. Last week, I think you don't remember it. Let me
Okay.
check
Mm.
on WhatsApp.
This was Aconite.
Yeah, yeah. That's I'm saying. Aconite.
Yeah, this was
Okay.
Aconite.
Okay, okay. Thank you.
This was Aconite.
हाँ, सर नमस्ते सर।
Yeah.
सर जैसे अपन ने किसी पेशेंट को 10 ml तक की डोज दे रखी है कोई केस में, तो सर उस पेशेंट को भी अपन बूस्टर डोज दे सकते हैं?
It's depend on circumstances. So just depend on the pathology of that case.
सर वो पोटेंसी कम होनी होगी सर, वापस 200 देंगे
We
तो?
are using booster dose when we believe that that person is no need of more, because all the symptoms are eradicated, everything is gone, the person is fully cured, and you wants that these symptoms, the person will not able to get all these symptoms again. In that circumstances we give booster dose.
थैंक यू सर।
Yes, anyone? So, okay, guys, see you next sessions, and we will continue. Yeah,
सर एपिलेप्सी क्लास के लिए सर जो फीस जमा कराने की लास्ट डेट है वो कब तक है सर?
3rd को हम शुरू करेंगे. After that, or before you can
फीस
you can submit before
ओके
midtime. So
ओके
see you guys for next session. We will discuss and continue. Thanks for joining today. And if you continues to join, we will discuss lots of cases. And I record one cases for you guys for uh, what we can say the practice. So tomorrow will be a repertory, and we will discuss that case in keynotes, and I will give you a wonderful experience of that case. See you guys. Thank you so much.
Thank you.